Aloha gang, Dr. Russ Rosen here, and we are in the OHC community. Is that true? I sure hope that's where I'm at. And we're going live. So if you are there, I'll go ahead and say, please, comment and let me know if you are here. And again, sometimes I don't see that, but my wife is going to be on, and then she'll be able to look because sometimes it just doesn't show up. Okay, so Dr. Russ Rosen, OHC community. My main focus is helping natural healthcare providers like you thrive in a care versus care true optimal health model. You want to help people get healthy and stay healthy for a lifetime. You want them to stay, pay, and refer for a lifetime. That's what I do. We go live 3 Tuesdays per month at 1:30 California time, which is right now. So again, the way that we're doing this, what I used to do is I would go live and I would teach the class. But Facebook is no longer keeping these live videos for more than 30 days. And I want you to have access to what I teach for longer than 30 days. And we put them in the guides section. If you go to the guides section and go to master class, you can see dozens of the master classes that we've done so far. And you will see the one that I posted earlier this morning. So the way we'll be doing it is in the morning, I'm going to teach the class. I'm going to post the video. I'll put it in the guide section. If you just scroll down right now, you'll see it should be the first thing because I did it earlier this morning. And it is called Mastering the Art of an Exceptional Doctor-Patient Consultation. So my goal is for you to be able to view that. And I'm trying to get them not as long as they used to be. They used to be 30 minutes to an hour. Today's was 18. My goal is 10 to 15 minutes. I've been told if I make them shorter, more people will watch them. News at 11, we'll see if that's true. So you can, again, either go to the guides section to masterclass, and it will be right there, or just scroll down from here and it'll be there. If you can watch it ahead of time, then you can come up to this, and then if you have any questions, just go ahead and post them. Now you can, if you watch the video, just post the questions there. At this moment, there aren't any there, but if there were, I would answer them right now. Or if you're with me live, you can just go ahead and type it right here, and I'll answer any and all questions. So let me see. All right. So if you're there, let me know. If you have any comments, let me know, or questions, let me know. It looks like it's still trying to post that, so I don't know. So what we'll do in the future is in the morning, I'll post it. You can watch it. Any questions, you'll type that out. I will then come on at 1:30 California time, 3 Tuesdays a month at 1:30 California time, and I'll answer any and all questions, or be here live with me and then go ahead and just comment right here and I will answer any and all questions. This Thursday in the club, we're going to spend an hour diving deep into this concept of the consultation, the specific 6 things that need to happen in the consultation, and then that one piece which none of us have learned how to do the right way as far as I have found, and that is helping people very quickly get to why are they actually here? Why are they here? And I know the most common answer is because of their symptom. Nothing could be further from the truth. They're never here because of their pain. They're never here because of their symptom. They're here because of loss or potential fear of loss. And we need to find out, why are they here? Are they concerned about the diagnosis or lack of diagnosis? Do they just really need to describe their pain before you can move on, or a symptom? But eventually it will come down to how it's affecting their life, or they're concerned it might affect their life. And I'll show you how in a matter of moments. Now it'll take us It's going to be an hour, that class. And I will, if you're there, it's on Zoom. So we're talking to each other. We're not doing it like this, where I'm waiting for someone to type, but we'll actually have the conversation with us. I will draw it out of you. I'll help you understand exactly how to draw the story out of your patients using the neuroscience of communications. Take what you want to teach them, and instead of cramming it down their throat, you're going to apply your story to their story. By the end of that time together, you'll be an expert at doing it. You'll go back on your very next consultation and have a very dramatically different experience than you're having right now. Okay, so apparently nobody's here with any questions right now. Let me see, is that true? I think that's true. I'm going to go check somewhere else because it just is supposed to work where it shows up, but it doesn't, which nothing I can do about it. I guess I'm going to call up my friend Mark Zuckerberg and see if we can get that straightened out. Okay, so there's me. Okay, and it says that there's 4 comments. Yeah, these were not showing up. So, Theo, Dr. Theo, good to have you there, brother. It's been a long time. Kat, she's there. She's my wife. Theo, my question for today would be examples focused for table talk and visits 20 through 24, and again to patients who are in and coming weekly for ages. Okay, fair enough. I'll get right back to that. Good. Okay, so here's the deal. Theo, we're going to be dealing with that next week. So next week is, oh no, I take it back. There'd be the exam, then the report of findings, and then daily interactions. But I'm going to address that with you since you were kind enough to show up and ask. So here's the deal. I asked doctors, in fact, Theo, I'm going to ask you this question. I'm going to ask you to go ahead and comment right there. Around how many visits before someone starts to feel better in your practice? Around how many visits before somebody starts to feel better? And I'll refresh this and just see if you are there and you comment. But let me scroll right down here. And I'll just check again in just a second. So just remember this, and we are always looking at this path to optimal health. So -10 is near death. 6-day visits. Thank you, Theo. 0 means I'm comfortable, I feel good, but I'm not functioning at my optimum. If we redid the tests, they wouldn't be clear. If you're doing corrective x-ray care, they wouldn't be clear. If you're doing brain function tests, if you're doing neurofeedback tests, if you're doing electromyograph, thermograph, if you're doing spit, pee, and poop tests, doing blood tests, they're not healthy. Right? If you're doing myotomes or muscle tests, they're not healthy, they're not strong, they're not balanced, but they feel better. So for most people, 6-day visits, it's right around what it is, 6 to 8, 10 visits, maybe 12, people are starting to feel a whole lot better. So the question is this: if we were helping people get healthy and stay healthy, and Theo, thanks for playing along here. I'm going to ask you this question. If somebody, aloha Scott, good to see you. If somebody really understood the value of your care, Dr. Theo, and they wanted to get healthy and stay healthy for a lifetime, what should or what would you like your PVA to be? What would you like your retention to be? Theo, and I know we have like about a 6 or 8 second delay here. So for most, in my world, if we're trying to help people get healthy and stay healthy for a lifetime versus just feeling better, then I want the minimum of our PVA or retention, the minimum, to be 60. I'm going to hit refresh here and see if that shows up. There we go. Okay, not yet. Okay, so I want a minimum to be 60. I really want it to be over 100. So how do you figure your retention? Just take your last 3 or 6 months worth of 90% plus, PVA over 100 plus. Thank you, Theo. And I know you do. So, Theo, I know you understand this, so I'm not just speaking to you because I know you understand this, but for the other folks that might be listening that don't understand it, you just take the number of patient visits, say in your last 3 months or 6 months, divided by the number of new patients, and that's the average number of patient visits that somebody is going to see you. Some, I get it, have seen you for the last 30 years, but some came and left after their first visit and never came back. So Theo just said he would like to have over 100 PVA. Everyone I coach, I want to be over 100. I have lots that have been in the 200s. So if we take a look at this right here, and Theo says, the average person that comes to see me feels better within the first 6 to 8 visits, but he wants to see them over 100 visits. That means that there's this whole area right here that most of us have never been taught. We've never learned how to communicate. And there's a very big difference, because when people are here, they're moving away from their symptoms. They're moving away from the loss or potential fear of loss. They're moving away from what they fear. Here, they're moving towards what they want. Now, if you meet somebody who's got a 10-penny nail driven through their forehead, and you start talking with them about optimal health and moving towards what you do want, they're not going to hear a word you're saying, because they're here. So you have to talk to them differently if they're here. Theo says, since we shifted to 90-day plans from 12-month plans with board changes. Okay, so if I understand it correctly, you had to stop doing your 12-month plans because of the board changes, and you went down to 90-day plans. Yeah, that it's dropped down to 24. Okay, so there is a whole lot to this, Theo. The trick here, all right, let me finish this. So we need to start to learn how to have conversations with people here, as well as when people are here. And if we don't learn to have conversations with people when they're here, I'm healthy, I feel fine, I know there's room for improvement. If we don't learn to have these kinds of conversations, then people are going to drop out much earlier, right? So the average PVA worldwide is about 20 and dropping. It's going lower than that. Theo, yours is about 24. And obviously, you went from a 12-month plan down to a 24 visit plan, or a 90-day plan that's probably right around 24 visits. That's what happens. So we got to get really clean in visit 1 and visit 2 about what do they actually want in relationship to what we can actually do for them. Okay, what do they want? They just want to feel better, knowing that they didn't resolve it, but that's okay for them right now. Or they want to get as healthy as they can get, and here's how we would know. So we got to get really clear about that at the beginning, and then we need to learn how to have this conversation with them. Okay? So we will address this in 3 weeks. In 3 weeks, we're going to address about having these conversations, but I want to just lay that out. That's what we start to need to think about. We need to start to think about that. We have problems involve more symptom focus and missing the scale plan. Yeah, so that's what ends up happening. Because, see, now here's the deal, Theo, and what I'm going to ask you to do, if you're in the mood and you would like to talk about this, just go ahead and message me or email me, Dr. Rosen at the 𝗿𝙤𝗬𝙯.com, or message me, and let's set up a time and talk, because I can help you through this. We've worked together in the past. But here's the deal. I coach a lot of doctors who do not do year plans, who really just start off with the first 1 to 2 or 3 months. I personally, when I was in practice, never recommended more than 6 weeks at a time. Why? I didn't know about it, and I didn't know how to. I certainly do now, and I would do that if my registration board allowed me to. And I know that they're not allowing you to do that down under. But the trick is you don't have to do this and set up a 12-month plan to get them to stay as long as you want to. You just have to be very clear about how to chunk it down and how to create value, right? And so there's probably a piece that you're missing, Theo, and if you would like to talk that down with me, just go ahead and message me and or email me and we'll set up a time and I'll talk that down with you, because I know we can help you do it. But I can promise you this has fallen out. This has fallen out. We have gone much more into talking about symptoms versus getting healthy and staying healthy, and then we don't chunk it down for them. So, and then it becomes a vicious downward spiral. That's what ends up happening. Let me just see. So Theo, if that works for you, I'd love to be able to talk with you. Will this be available on replay? Yes, it will. It will, and maybe I'll even take it out of live. Let me see, and download it and then re-upload it, because this is good information and I want to make sure you get it. So I think I'll also re-upload this in the guides section, so you can get that. Okay, let me see if there's any other. Oops. Wow. Where did I go? There I am. Okay. So, sounds good. You reach out. Good after Easter. All right, mate. Good to hear from you. Yep, I'll do the replay, Theo. Yep. For some reason, it's not showing the rest. Okay. So, if there are any other questions, let me know right now. If not, I'm going to head on out. So, again, I'll wait about 5-6 seconds to see if any other ones show up. Nope. Okay. So, I hope you found that valuable. Again, as far as the daily interaction stuff, we'll be getting into that in three weeks. If you know other people that you think would find value in this free content, please let them know about it. Really trying to get to 1,000. We're at 708 right now, so I'd love your help on that. And also, if you would like to dive deep into a conversation, not like this, but in Zoom, where we're actually talking to each other, I will draw out of you how to help you draw your patient's story out of them and apply your story to their story. We're going to spend an hour on the consult in that particular subject. So hope you find value. As always, much love and aloha. Bye, gang.